Good afternoon, everyone. Thank you so much for choosing to join us today for our discussion on body mechanics to reduce physical stress. I want to start by taking just a quick moment to further introduce ourselves and telling you why we are here to talk about such an important topic, or what I think is an important topic. My name is Leah Goldberg, and I've been a perioperative registered nurse for 14 years. Unfortunately, in that time, I've seen many of my coworkers struggle with workplace injuries that have resulted in physical pain from musculoskeletal injuries. And I myself, unfortunately, have also suffered from some injuries from work. But I want to help you avoid those experiences. I'm not an expert in this field, so I've made some friends, and these two gentlemen with me up here today are going to help explain how we can make simple mechanical changes to reduce our risk of a musculoskeletal injury while we're at work. So I'm going to let Glenn and Alex take a moment to further introduce themselves, and then we'll get into our presentation.
Okay, hi everyone. My name is Alex Papanastassiou. So I'm a physical therapist. I work for IV Rehab, and I'm a clinic director at the West Hartford location.
My name is Glenn Foreman. I'm a physical therapist and a clinic director at our Avon location for IV Rehab.
All right, thank you guys. Okay, see how this works.
It's gotta be, hang on, is it on? Yeah, I was just playing with too.
Okay.
Did you do that or did I do it?
Okay. So we are going to start with a disclaimer. This presentation is intended for educational and informational purposes only. The content shared reflects general best practices, current evidence, and professional insights. It is not designed to provide individual health assessments, diagnoses, or personalized medical advice. And you as the attendees are encouraged to consult with qualified healthcare professionals for any of your specific concerns. And your participation in this session today does not establish a provider-patient relationship. That being said, here are our objectives for today. By the end of this presentation, you will be able to discuss common workplace injuries for perioperative staff, describe the importance of core strength and mobility in body mechanics, and also demonstrate changes to body mechanics during common tasks for perioperative staff to minimize physical strain. And that's what we're going to highlight today. So take a moment. Do any of these stories sound familiar to you? Okay. Rachel, or not Leah, an experienced operating room nurse, is asked to retrieve a set of instruments quickly for the field. With limited space and urgency in the room, she twists her torso and lifts the heavy instrument tray without proper support or assistance. Suddenly, she feels a sharp pain in her lower back. Despite trying to continue, the discomfort intensifies, forcing her to step away and seek medical attention. Later, it's determined she strains her lumbar muscles due to improper body mechanics. So how about this one? During a complex orthopedic procedure, Sam, a surgical technologist, reaches throughout to reposition the surgical instrument trays. After several hours of this repetitive motion, she begins to feel a dull ache in her left shoulder. And by the end of the shift, the pain has intensified, limiting her range of motion. Unfortunately, she's developed rotator cuff tendonitis due to this repetitive strain and the awkward arm positioning during surgery. And now I know this picture does not demonstrate proper sterile technique, but AI can only do so much. So let's just pretend that's after the surgery and she's cleaning up her table. Here's another story for you. Julia works in the sterile processing department. She spends hours each day sorting and organizing surgical instruments to prepare our trays. The repetitive motion of gripping, rotating, and aligning instruments, especially during high volume shifts, places continuous strain on her forearm muscles and tendons. Over time, she begins to experience soreness and stiffness around her right elbow, which worsens with each shift. Eventually, that pain becomes sharp and persistent, making it difficult to perform even light tasks both at work and at home. She's diagnosed with tennis elbow caused by that repetitive strain. In each of these scenarios, the healthcare professional develops that pain that negatively affects both their work and lifestyle habits, complicated by endless medical treatments, missed work days, light duty, physical therapy, braces, or possibility of surgery with the necessary time for recovery. So what if we can take some simple steps to prevent these injuries? Realistically, we are all at risk of injury while we're at work. And the US Bureau of Labor Statistics documented just that. They said that over 500,000 incidents of job-related injury or illness happened to healthcare workers in 2023. And that's only the ones that went reported. How many get a pain or strain and don't report their injury? I am guilty of that too. So here's another staggering statistic. In a study at a level 1 trauma center in Boston, researchers found that although only 1.7% of all facility staff worked in the OR, this group accounted for almost 8% of workplace injuries. So obviously, perioperative staff are at increased risk, and we know that's because of the nature of our jobs. The work we do is strenuous, and whether we are working as a perioperative nurse, the surgical technologist, or the central sterile processing professional, or in another role supporting our OR, many of our tasks require similar body mechanics. So just to keep in mind that 500,000, there's a lot of different types of injuries we can get on the job, but in this discussion, we're going to focus on one of the most common, which is that pesky musculoskeletal injury. And these include damage to the spine, muscles, nerves, tendons, joints, ligaments, or cartilage. And the most common musculoskeletal injuries are to the back, shoulder, and knee. This pain or soreness is most commonly caused by a sprain, a strain, or a tear. And this pain can come from an acute event or occur from the cumulative effects of repeated ergonomic demands. And this risk specific to perioperative staff has not gone unnoticed. In fact, in the early 2000s, AORN had a workplace safety task force identify specific ergonomic safety risks for perioperative staff. And these are common tasks that put us at high risk that we perform every day. We transfer patients on and off OR beds. We reposition patients on those OR beds. We lift and hold patients' extremities. We stand for long periods of time. We hold retractors for long periods of time and in very awkward positions. We lift and carry supplies and equipment. And we push, pull, and move equipment on wheels. But these aren't the only tasks that can cause a musculoskeletal injury. The literature also discusses the potential harms of wearing lead. How many wear lead every day? I know I'm in orthopedics, we wear it all the time. How about this one I didn't think of? Carrying supplies in our limited jacket or scrub shirt pockets. Anytime I have things in my pocket, it's weighing it down. I can feel it on the back of my neck. It's so annoying. We're constantly opening doors. I didn't really think about this, whether they're cabinet doors, OR doors, closet doors. Some of them are very heavy against the laminar flow. That can cause injury. We're being forced into awkward physical positions. We're going around equipment, we're bending and moving awkwardly. I know I used to be more agile getting through a C-arm to the cabinet behind it. I hit my head a lot on it, but that's another story. We do a lot of repetitive motions. We work through illness and injury. And we do a little bit of computer charting, usually with poor ergonomics. So basically, doing our jobs puts us at risk. They also state that behavioral risk factors that were reported include feeling rushed and fatigued. And staff stress the need for education on basic ergonomic safety techniques. So here's another fun fact to share with you. When lifting and holding a patient's arms, legs, or head, like when you're prepping, it's important to note that muscle endurance decreases by 48% after 1 minute and by 65% after 2 minutes. I don't know about you, but it takes more than 2 minutes to prep and wait for the prep to dry and then let them start draping, and then they might take the limb from you. So I'm tired by then. I can tell you from firsthand experience, getting hurt at work is not fun. But it's also a major drain on the individual and our profession as a whole. So in 2013, a report from the American Society of Safety Engineers found workplace injuries among healthcare workers cost $13.1 billion and accounted for 2 million lost workdays. So for the injured individual, they can face both short-term and long-term pain, lost income, the need for treatments or surgery, missed workdays, or even missed life events. And this can all cause increased stress and be detrimental to our mental health. And this can lead to an early exit from our career. And for departments, having one or more staff members out or on light duty can really hurt the morale overall, and it can negatively affect staff satisfaction or retention. They can put the remaining team members at increased stress and therefore risk for injury themselves. And there's a cost to the facility for not only treating the staff member who is injured, but also training new staff members to take their place. And this can ultimately all affect how we're able to care for our patients. So what? We chose this career, right? So we knew the risk getting into it? No. We acknowledge that there's risk, but we can continuously work to reduce them to protect ourselves and our patients. So what can you do about it? How can you reduce your risk? Well, just like research shows success in limiting surgical site infections through the use of many techniques or that bundled approach, this complex issue of workplace injury requires a multifaceted technique. So this includes taking a proactive approach to injury prevention and encouraging that culture of safety, where staff can be comfortable speaking up about unsafe behavior, situations, or mistakes without fear of punishment. And this culture, as we heard before, must be supported by our leadership. There are many pieces of equipment that are designed specifically to decrease the strain of staff, the physical strain the staff are under. They must be easy to use and easily within reach at the time of use, like those transfer devices when moving a patient, appropriate carts to transport instrument trays, adjustable height surfaces when assembling instruments in SPD, or anti-fatigue mats while we're standing for such long periods. We can also follow guidelines and use basic techniques to prevent strain. For example, keep instrument trays below the maximum suggested weight. That's difficult on many levels. We think it would be easier to store our lighter instruments or supplies on either a lower shelf or a higher shelf so that we have the heavy stuff right at an equal playing field, but we don't. I know one of our heaviest trays is on the bottom, and that's just where it lives. So we know we're at these risks, and even in that perfect environment, if we did everything right, there's always a chance that there's going to be a problem. So AORN created guidelines for safe patient handling and movement. I suggest you take a peek at them. They include ergonomic tools that encourage limiting weight lift requirements and standing times, but no one has time to stop and weigh a patient's limb before they calculate how long they can hold it, or walk away when the clock says you've been standing for an hour. But there are certain things that we can do. So that's what we're going to focus on today. How can you take care of yourself so that you can take care of your patients? And because the most commonly discussed ergonomic risks are associated with tasks that all of us do on a daily basis, including pushing, pulling, lifting, and transferring. I'm going to let Alex and Glenn, our ergonomic experts, help teach us ways to keep us safe.
Okay, thank you very much, Leah. So I'd like to note that while Glenn and I are the biomechanical experts, Leah has been instrumental in making sure that the information we provide to you during this presentation is as applicable as possible to the tasks that you do in the OR every day. So she's been incredibly helpful for that. Thank you.
Thank you.
Okay, so our goal today is to show you as simply as possible what we consider to be the basic biomechanical positioning that reduces injury risk at work. We're very aware that nothing in the OR can be perfect. Things move fast, things are hard to do, and things are heavy. And we don't expect that the position we show you is going to be used all the time. But being able to get into what we consider to be a good position at a minimum is very protective. And if you can't get into that position, then you're going to be doing everything with a little bit more risk of a joint stress injury. Over the last year, Glenn and I have been doing some hands-on seminars almost where we go through some perioperative and nursing staff. I see a couple of people in this room, and we go one by one with them and go through an OR task and alter their positioning. And what we've found with a lot of it is quite literally it will be the difference between it hurting and not hurting. Like doing it in the correct way will take away the pain most of the time with these tasks. So our goal is to make it very simple and make it something that you can just click into immediately. The so-called good positioning is as quick to do as the bad positioning. It's just a matter of knowing what to do. When you have that choice, when you go and do something, it's the same speed. So we want to make it quick and easy for you. Okay, so everyone take a look at this picture, please. This is something that I would consider to be not so good body mechanics. But how often do you see someone at work doing this, or how often do you feel like you are doing this on your own? It happens a lot. Similarly, this is a picture of Glenn doing something, and this is somewhat of a common position as well, but I want to highlight he's got a bit of an excessive bend in his neck. His lower back's not in the best position for lifting, and his shoulder's at a bit of rotation that can place the shoulder at a little bit of a stressful position, or even some of the distal joints like the elbow and the wrist, they have to compensate for that rotation. So our goal, because it's easy to point this out and it's often easy to see on other people what the wrong position is, our goal is to show you what the correct position is and how quickly you can get yourself into the correct position on the fly. What we're going to do is explain those positions, and then Glenn's going to take you through some specific OR tasks and go through how that position applies to those tasks. And then we'll make you get up and do some exercise at the end. Not much, but just a little. Wake everyone up. Okay, so Leah's helped us break this down into these two main categories. Okay, so on one side we have pushing and pulling, and the other side we have lifting. Pushing and pulling is anything from transferring a patient from one table to another, pushing one of those heavy carts, or moving one of the heavy OR tables, because you're involved in pushing your arms forward or pulling something towards you. And then lifting denotes anything where you have to pick something up with your hands. And so that can be a patient's limb, where you have to lift and then hold it for up to minutes at a time, maneuvering trays, or carrying any sort of equipment. These are all things that require more force out of your muscles, and your body can compensate for not being able to provide that force by stressing a joint or holding a joint in a less than beneficial position. Okay, so I'm going to go through this real quick because on the next slides, I'm going to go through them one by one. So this is a picture of me. This is also a picture of Glenn. So what I've done is I've put myself in what we consider to be a better position. What we've done is we've started with a neutral pelvis position. I'll explain this, don't worry. And then we've stacked a long spine position on top of this to help set a good starting position through the whole trunk. The next rule is you have to stabilize that, because as force increases during a task, you need to be able to stiffen and hold the correct posture of your spine or pelvis in accordance to that force. And then, because everything you do involves your arms, and often your arms have to hold like a 25-pound equipment tray or a heavy limb, you need to be able to use your arms without compensating through your neck or your wrist or your shoulder, and you need to understand what those compensations are. So we took a couple trial photos, and this is what we figured to be the best photo. So you can keep that in your mind as we go through this. And then we're gonna go, I wanna mention flexibility too. We'll go through that a little bit later on. The full breadth of flexibility is a little beyond the scope of this because there's so much that goes into it, but flexibility is just, it's so important. If you don't have the flexibility to get into certain positions, then you're gonna be starting behind the starting line because you're going to automatically be compensating to get into a certain position. Okay, we start with a neutral pelvis. So the pelvis can basically go anywhere from an anterior tilt, which tips the spine forward, to a posterior tilt, which tips it back, and then anything in between. For most people, somewhere in the middle of that is going to be the most comfortable, okay? For a lot of people, that it generally involves a slight posterior pelvic tilt. It doesn't have to be much, and you can see between these two photos of the left being good and the right being not as good, that it's fairly subtle, but it doesn't take much to restore a better position of the lumbar spine joints, okay? And so, again, we'll take you through that a little bit later so you get a better feel for how to do that. But the neutral in the middle pelvis position allows us to stack what we call a long spine on top of it. So generally, if it looks better, it is better because that involves that the joints are in a better position all next to each other and they're not hanging out in the end range that's going to stress a muscle, a tendon, or a disc. Okay, so on the right is a less than optimal position because I've lost the length through my spine. And you can see the bend in the neck. Oops, get there. Let's see if I can do this. All right, the bend in the neck, and then the less than optimal lumbar flexion for applying force. Okay, whereas on the left side, what we've done is we started with a neutral pelvis position, lengthened your spine on top of it, and that sets you up in a more effective position to produce force. Okay. Once we have the position, we have to stabilize it. So you want to be the left-sided Coke can, okay? You don't want to be the right-sided Coke can. So literally, all you're doing is getting the correct position and then stabilizing it. So what I want everyone to do is punch themselves in the stomach. I'm serious. Not hard, not hard. So what you'll find when you do that is you reflexively tighten those muscles, okay? That's what it is. So this is not something that I want you to do all the time. You basically do this more in accordance with how much force you have to produce. So if you're picking up a 25-pound tray or a 25-pound limb, you should be applying a similar amount of bracing force through your abdominal muscles to stiffen your spine and hold you in position. If you're picking up like a 3-ounce piece of equipment, you shouldn't have to do it at all because that'll rob you of a little bit of flexibility that you need, okay? One more caveat is when you punch yourself in the stomach, you can't crunch. You can't stiffen your abdominal muscles by bringing yourself down because that's a loss of the long spinal position. Okay, so again, what we want is find a little bit of a comfortable neutral pelvis position, make your spine long on top of it, and then just brace it. Okay. Make sense so far? From there, because you use your arms for everything, you need to understand how do I get my shoulders into a better position and stabilize that. You're producing force through your arms on top of what needs to be a stable trunk. So there's a lot of compensations you see through the neck or through the shoulder or even through the wrist to help you stabilize that position that are there to help you out when you get tired or just produce more force in general. Like if you look at this bottom left photo versus this one, this is me dropping my head to put my shoulder in a more strong position as it fatigues. But what that does is it places, now you're exchanging the position of your shoulder for the position of your neck, and your neck is in a less than optimal position. This is the kind of thing that hurts. Like I think when I was demonstrating this photo, it hurt. And then on the right side, what we're getting here is a rotation through the shoulder. That places the rotator cuff in a little bit of a risky position. This is not even necessarily the thing you'll feel immediately, but if you do it over and over again for years, it will hurt more. The shoulder's a little bit more subtle. So I think most people intrinsically understand what it looks like when the head is forward and that's not very comfortable, and what it looks like when you round your back when you lift and that's not so comfortable. But the shoulder compensations basically amount to flaring your elbow, shrugging your shoulder, or popping your head forwards. Those are all compensations that you use to help put your arm or shoulder in a more advantageous position to produce force. So the solution is you pull your shoulders back to help stabilize, and you bring your neck back a little bit using the muscles in front of your neck to help stabilize. So with those all together, you have a neutral pelvis that you have stacked a long spine on top of, and then you have stiffened it. This creates a strong position where the joints are in a comfortable spot to produce force, okay? When we've done some of these classes, this literally, again, if you get into this position and then do something, it doesn't hurt. And a lot of people have an idiosyncratic way of doing it on their own that is painful. And once you learn this, it's very simple. You can just immediately click into it. It takes no more time. Because again, it's a matter of stepping down into the wrong position or stepping down at the right position. It takes an equal amount of time. These are things that come Monday, you can just start doing. So Glenn's going to take you through that as it applies to specific OR tasks, okay? But in the flexibility, again, it's really hard to show, and it's beyond the breadth of this presentation because there's so much that goes into it. But this is a picture of Glenn with great mobility. And if you don't have the requisite flexibility through the joints, you're going to do something else, okay? If you don't have flexibility in your hip, you're going to move through your back more. If your shoulders don't move, you're going to move through your neck more. So overall, maintaining a degree of flexibility is very, very, very protective. We have a couple exercises that we'll show you to get you started to think about that. Okay, Glenn's turn.
Beautiful. Pushing and pulling tasks. So think about when you're in the OR, you have to transfer a patient doing a log roll. We're also going to apply this to when you're pushing or maneuvering those heavy carts as well. So in this picture here, we're pulling that chuck pad. Alex's head is nice and neutral. He's giving us that nice, simple chin tuck. Shoulder blades are hinged and squeezed together. And his hips, they're not extended, they're not rounded, they're nice and neutral. When he's pulling in his core, think belly button into your spine. You're breathing, you're talking normally, you're bracing your core, you're elongating your spine and stacking it like that Coke can. Legs, comfortable, widen, and weight shift if he needs to. The arms, the shoulders, we're not rounded, we're not lifting them up, we're keeping them nice and controlled. Going into when you're pushing, same concept. Nice long lines, long spine. You want everything from your heel even to be completely elongated and stabilized, ready to push or pull. So anyone here who does this or seen someone do this picture here? And again, you guys are transferring patients. It's a quick thing to do. In this formation here, you are increasing your spine loading unevenly. So increase low back pain. Look at his shoulders, look at his neck. You're crunching that positioning up there. As Leah mentioned, every 45 seconds, your endurance is decreasing. So imagine your endurance is decreasing, you're tired. It's been a long day, you're in a poor positioning there. What's gonna happen? Slip disc, spinal stenosis, shoulder pain, tendonitis, anything. The most important part, stabilize yourself. Get yourself in a nice neutral positioning. Take a second to set yourself up. Okay, next one. Lifting and reaching. Does this look familiar to everyone? This could be 25 pounds, some of them could be longer, wider, and there's still instruments in here. So you can't just maneuver it any separate way. You have to keep yourself nice and controlled. Same thing here. I'm not like this, carrying it. Nice and tall, I'm pinch my shoulder blades together. My core is nice and engaged. My neck is nice and neutral. When I say pull your neck back, everyone tends to do this. Keep yourself nice and looking forward. When you're ready to lift, maneuver it. I'm reaching around. I'm not elongating. I'm not rounding my rotator cuff. I'm locking in my shoulder blade. My feet are staggered. I'm comfortable. I can place this, put it underneath, on top, wherever the case may be. Okay. Same thing going back to resting posture. When we're charting at our desk, we're sitting. Those chairs are never the ideal positioning. Same thing when I'm typing away. Nice, good posture. My head is facing the screen. I'm here. I'm not doing this. My head's not hanging forward. This is going to cause more stress, more pain. Okay? Yes, again, good posture. I'm not shrugging the shoulder. This one here, trying my best to shrug that shoulder. Again, we're tired, we're exhausted, but this will just kind of give me more pain in the long run. Over the years, shoulder, neck pain, back pain, not good. Okay, next one for me. Alrighty, everyone stand up for me. Have some fun.
You got to have something to take home, right?
And if you guys can, push in your chairs and spread out for me, okay? Alrighty, we're gonna do the rocking pelvic tilt. We don't have a wall, but think about hands on the hips. As we mentioned before, you're gonna roll your hips forward, right? This is called an anterior pelvic tilt. This will increase low back pain. Roll your hips backwards. Posterior pelvic tilt can also increase low back pain if we're not careful. I want you to rock back and forward. I want you to find that happy medium where you're like, okay, I'm in between anterior and posterior pelvic tilt, and hold it there. Breathing normally, you're thinking about bringing in your belly button into your spine. You're talking, breathing. Good. Make sense? Now widen your feet a little bit wide, shoulders apart. Soften your knees. I want you guys to weight shift from side to side. Be as comfortable as you can. And if you're super, you can also try that pelvic tilt while you're weight shifting. I want to be as comfortable as you can, okay? Same thing, stagger your feet. Put one foot in front, one foot behind. The closer we are together, the more unstable we are. Widen your stance a little bit more. Again, same thing, pelvic tilt, cores engaged, rock forward and back. Think about when you're having to pull or push those heavy carts, pushing a heavy door. Easy, comfortable. You're stacking your spine, elongating your spine. Good. Switch feet, same thing. Keep it even. Forward and back. Good. Beautiful. Neck and shoulder stabilization. So this one's a little tricky. And have your partners next to you kind of reference if you're doing this correctly, okay? So think about nice and tall. I want to elongate my spine, elongate my neck. I'm pulling my chin back. My head is going back, elongating my neck. I'm not tucking it down. I'm not extending. I'm here. I'm just pulling my head back. While I'm doing this, our shoulder blades, we're going to pinch them backwards. We're not shrugging. Keep your shoulders down and back, and you're pulling the head back. Okay, let's see if you guys can do that. And now keep your spine, keep your pelvis in neutral. And that's 3 things, right? You gotta breathe also. Develop into your spine, squeeze your shoulder blades, relax the shoulders, good. Good. I love it, I love it, I love it. Now think about how quickly you can get into this positioning here. Anything you guys want, squeeze, good, boom, ready to go. Shift your weight back and forth, right. All right, thoracic rotation in a split stance. So think lunch break, you have a quick 5 minutes, a quick snack. This is to improve your flexibility. All this is great, but if you can't get your shoulder blades or your pelvis to be in that neutral spine, it's a waste. So without hitting anyone, hands up. I'm gonna stagger, so if you're facing to your right, you're gonna put the front leg in front, you're gonna open up your thoracic spine. And you're gonna realize, oh, I'm limited. I don't want anyone to have any shoulder pain. So if you're feeling as if your shoulders kind of jutting forward, decrease the range a little bit and then pull. Good. If that is too difficult, switch your feet. Again, think about my hips have to face forward, my legs are relaxed. I'm here, I'm opening up that thoracic spine. For the head, if you can, keep the head towards your hand or your thumb, okay? And switch legs, switch sides, keep everything even. Good. Beautiful. Good. Beautiful, beautiful. All righty. And then my favorite stretch, the upper trap stretch. We all carry our stress in our neck and our shoulders. How can we do a quick fix? So take your right arm over your head, left arm slightly behind your back. I'm sitting up nice and tall, and I'm pulling my right ear to my right shoulder. I'm holding this for about 15, 20 seconds. Okay, you're not pulling to crank on the head to cause pain, just a nice gentle stretch. Okay, if the arm behind the back is uncomfortable, either side is fine. Think about reaching towards the floor, pulling that head to your shoulder. Okay, I'm not shrugging this shoulder, by the way, I'm keeping it nice and relaxed. Other side, same thing. Here, nice deep stretch. Beautiful. How do you feel? Good?
Can we do the next one?
The next pose?
Yeah.
If you guys want another quick one for the neck as well, think about turning your head to like the 45. Arm goes behind your back also. Think hand on top of the head and you're just kind of pulling your chin down to the armpit. Okay, this gets the levator scap there. Again, all these muscles will help decrease stress, tension, headaches, all through your neck and your spine as well. Okay, these two are your best friends, thoracic rotation and the upper trap stretch. Make sense? Beautiful.
A few more maybe, Glenn?
All right. And all of these exercises are all in your packet, so you have to reference them there, okay?
Great job, everyone.
Nice job.
All right, everyone take a seat again, please. Nice job. So I'd like to reiterate again that this represents a position that you should be able to get into, especially as the force demands increase. There is, for the pelvis, the spine, and the stabilization, there is no expectation to do that for tasks that are very light necessarily. You should be able to get your spine in a good position because that represents a position in which the joints are at the least stress. But you shouldn't be overly bracing because that's not a habit you want to get to for very light tasks. You need a range of stability and a range of flexibility. And if you have both of those things, you'll be much more successful at work, okay? So as far as available resources go, in Connecticut, you can get a PT evaluation without necessarily seeing a doctor first. We're what's called the direct access state. So you generally can get 6 visits in or 30 days with a physical therapist before requiring a referral from a doctor. As far as generally pain goes, I know there's degrees of pain, but I think a lot of people's first solution is just to keep waiting and see if it goes away or see if there's anything they can do on their own. And I'd encourage you to try and go get some management from the gates, because a lot of times these things, when left going on for longer periods, that's when they start to build, and then you incur another issue later on. And then, so if you do get injured at work, the occupational health department is a great resource for you.
Okay. So in conclusion, I want to thank Glenn and Alex for really taking the time to learn and teach us about basic body mechanics that really apply to everything we do on a regular basis at work. I think they did a great job breaking down our everyday motions to show just how those small changes can make significant impacts to reduce the risk for potentially serious workplace musculoskeletal injury. I know it might seem a little overwhelming hearing them talk and making all these changes, but from experience, it really, once you learn how to position your body, it really does become second nature to try to go into that position right away. And what's great is, as Alex said, is you can really take some of these changes and implement them at your next shift and even outside of work. So we also encourage you to take the time and practice those exercises so that you can learn that you're training your body to move in the proper ways to really improve your resiliency and lower your risk. So if anyone has any more questions, they'll be at their booth and can go over the exercises again. And finally, the literature suggests that just like with communication, initial and ongoing ergonomic education is really important to improve your safety. So share what you learned with your coworkers and keep expanding your knowledge. So to wrap it up, taking care of others is really at the heart of what we do on a daily basis. But that care really does start with you. By learning and practicing these proper body mechanics, you're not just taking those steps to prevent an injury, you're investing in yourself and your ability to continue providing compassionate care for a long and healthy career. Remember, you can't pour from an empty cup, and prioritizing your own health is the first step in making sure you're always ready to help care for your patients. So we want to say thank you for your time today and open up to any questions.
I definitely have taught like people the body mechanics of the back stance, which is particularly with moving patients. So, but the other piece I've always wondered, once you're in that nice neutral position, right? You got your legs staggered, you're straight, you're reaching for that patient, pull them onto the bed or off of the OR table. Is it better to pull or to lever your body up and use a little bit of your hips?
I'm gonna say both.
A little bit of both. Because I've seen people, you know, doing this and they always hurt their shoulders.
Right.
And I see people, oh, my back. So I knew how to.
Absolutely, absolutely. I love what you just said there. You just staggered your stance,
Yeah.
right? And that little weight chipper we're doing, think about using your hips to go backwards. So combine them. So when you're here and you're pulling, exactly. So when you're pulling through those shoulders here, I'm weight shifting, sticking my hips backwards, and then I'm pulling. Again, my spine has not flexed or extended in any weird way. Weight shifting while I'm pulling. Okay.
Yes, if I can just add on to that real quick, actually. But I noticed, I saw you do that you said hurts people's shoulders is leaned back to pull. And so what you're doing there is you're losing the position of the brace and the trunk stability. So you want to maintain that as you use your hips to initiate the weight shift. And that way you're controlling all the joint positions with the increased load.
Thank you.
So I come from a facility that both the surgical technologist and the nurse will scrub. And I have been in surgical procedures that have been like 14 to 16 hours, you know, a couple of breaks. What do you do for the, I mean, just standing for that long, it just kills you sometimes. Are there recommendations that you would have for that person that has to be in a sterile environment, standing in a 1 foot radius for that long?
Here's one, Alex.
Yeah, so it's tricky. And this is one of the things that gets into like nothing can be perfect. There's an element of strength that's beneficial. You know, even holding the correct position will cause your muscles to fatigue out. But the less of the correct position you are in, the quicker they'll fatigue. So that's where we really recommend finding that neutral pelvis position, which again is going to be a little different for every single person here, and trying to comfortably, with a low amount of tension applied, get into that, because that'll be a relaxed position for you to maintain the whole time. Even that's probably not going to fix the problem. So what I'd recommend is changing your stance as much as you can. If your feet are here versus here versus here, it allows different shifting through your hips as you do it, and allows you to, I would say, almost hang on different portions of the musculature. When you hold your legs this way the whole time, you're gonna be fatiguing the same set of muscles consistently. So if you get over here, you can hang on this hip a little. If you get over here, you can hang on that hip a little. This is where it comes into the importance of the flexibility, because the more, we'll say, movement variability that you have, the more you can utilize different portions of the musculature and joint to help be fatigue resistant. So again, we want a little bit of the gentle pelvic tilt to be able to start at a good position, but you need to be able to move around as well. within that little
And
narrow
JD,
box.
when I do scrub, I find that I'm immediately getting tension in my shoulders because I'm holding my arms up and I'm standing. And what Glenn just showed us with just those simple stretches of moving our shoulders back, there's no reason why we can't take a moment to stretch a little bit, move our neck a little bit, get some motion back rather than standing so stiff while we're right in that surgery.
Also, practice. Right now, sit up nice and tall, smooth shoulder blades back, pull in your core. You're building your muscle endurance. If you practice when you're in the OR for 14, 11 hours, it should come naturally to you. Okay?
But at the end of the day, you're going to be
Yeah.
there's nothing we can do. But again, that's where that multimodal approach comes in too, is there's anti-fatigue mats, there's other tools that we can use, whether it's, giving, better break schedules or something, so that we can, add these things together to make it as safe of an environment as we can.
Always tap the foot up and down off like a step at the end of the day.
So smart. Yes, very smart.
Yeah, any one position is uncomfortable if you stay there forever. So you want to roll around to different positions as you go, while understanding that there's like a basic template for stuff as the load increases that we just went through.
Excellent. Thank you guys so much.